Bismillahirrahmanirrahim. Today we will discuss about the arm. The arm is the part of the upper limb that is located in between shoulder and the elbow. We will study about the muscles of the arm. The muscles of the arm can be divided into two compartments. They are arranged in two compartments. One is anterior compartment and another one is posterior compartment. In anterior compartment of the arm there are three muscles, and in the posterior compartment there is only one muscle. Now the question is how we divide this compartment. That means what is the determinations of this compartment. We divide the arm into anterior and posterior compartment on the basis of fascia. Fascia and septa. So what are these? In the arm there is a sheath of deep fascia which surrounds the arm. This is known as the brachial fascia, and there are some septum, two intermuscular septum. One is medial and another is lateral. While we studied the humerus in the lower end, there was two ridges. One is medial supracondylar ridge, this was medial supracondylar ridge, and this was lateral supracondylar ridge. In the medial supracondylar ridge there was medial intramuscular septum, and in the lateral supracondylar ridge there was another septum. This is lateral intermuscular septum. These two septa as well as the brachial fascia, this divides the arm into anterior compartment and posterior compartment. That means the structure which lies anterior to this intermuscular septa and the brachial fascia, these are known as components of anterior compartment of arm, and those lies behind the fascia and septa, they are known as a posterior compartment of the arm. So you can see these septa, that means medial and lateral intermuscular septa, and the fascial slip, that means brachial fascia. It divides the arm into anterior and posterior compartments. Then each compartment has its own muscles, nerve and blood supply. Now look at this very nice picture. Here we can see this is the medial intramuscular septum. The greenish structure is the medial intermuscular septum, and this is the lateral intermuscular septum. So in front of this septum, this is the anterior compartment of the arm, and this will be the posterior compartment of the arm. We already told in the anterior compartment there are three muscles, and in the posterior compartment there are only one muscle. There is only one muscle. So what are they? Look at that. This is the biceps brachii. This is the biceps brachii. This is the brachialis, and another muscles. There is a coracobrachialis. It is not shown. It will be just in that position, coracobrachialis. So three muscles: biceps brachii, brachialis, and coracobrachialis. And then in the posterior compartment there is only one muscle. This is the triceps brachii. It has three heads: lateral head, medial head, and long head. So this is the lateral head, this is the medial head, and this is the lateral head, this is the medial head, and this is the long head. So in the posterior compartment one muscle, this is the triceps brachii, and in the anterior compartment three muscles: biceps brachii, brachialis, and coracobrachialis. So let's start with the anterior compartment of the arm. So in the anterior compartment of the arm, we already told three muscles: biceps brachii, coracobrachialis, and brachialis. and we already studied that each compartment has its own nerve supply, own blood supply. Okay, so look at that. All these muscles which are located in the anterior compartment of the arm have their own nerve supply, that is the mosquitocutaneous nerve, and their own blood supply, this is the brachial artery. This is very important for both viva and written. Okay, so the anterior compartment muscles are three, and nerve supply is mosquitocutaneous, and the artery is brachial artery. Okay, besides this, some other structures that passes through the anterior compartment of the arm, we can see some median nerve, ulnar nerve, and median nerve also passes through this anterior compartment, but the main nerve supply is the musculocutaneous nerve, and these three nerves passes through this compartment, so they are not the nerve supply of the anterior compartment. The nerve supply is the musculocutaneous nerve, and this nerve just passes through the anterior compartment of the arm. That means they use this route only. So now let's study the origin, insertion, nerve supply, and actions of the biceps brachii. Okay, so at first come to the biceps brachii. The biceps brachii, we know biceps brachii has two heads. One is short head and another one is long head. The short head arises from the tip of the coracoid process of the scapula, and long head arises from the supraglenoid tubercle of the scapula. Then insertion, it is inserted in the radial tuberosity, posterior rough part of the radial tuberosity. Radial tuberosity has two parts, anterior smooth part and posterior rough part, and it is inserted in the posterior rough part of the radial tuberosity. Nerve supply, we know all the muscles of anterior compartment is supplied by the musculocutaneous nerve, because the biceps brachii, brachialis, coracobrachialis all are supplied by the musculocutaneous nerve. And action, its main action is the supinations of the forearm, as well as it causes flexion of the forearm. So let's see what does it look like. So this is the biceps brachii muscle. Look at that, it has two heads. Short head originating from the tip of the coracoid process of the scapula, and long head arising from the supraglenoid tubercle of the scapula. This is the supraglenoid tubercle. So after arising, they passes through the anterior compartment of the humerus, and they ultimately inserted in the posterior part of the this is the radial tuberosity, posterior part of the radial tuberosity. Here it is inserted. Then come to the next muscle. This is the coracobrachialis. The coracobrachialis, it is originated from the tip of the coracoid process along with the short head of the biceps. So from the tip of the coracoid process, two muscles arise. One is the short head of the biceps, and another one is the coracobrachialis. Then where it is inserted? It is inserted on the medial 1/3 of the medial border of the humerus. And in some book it is written as the medial 5 cm of the medial border of the humerus. So you can say medial 1/3 of the medial border of the humerus, or medial 5 cm of the medial border of the humerus. The nerve supply is the same, musculocutaneous nerve. And what is the function of coracobrachialis? As it is a muscles of the anterior compartment, almost all the muscles in the anterior compartment of the arm or anterior compartment of the forearm, they causes flexions, or the anterior compartment of the arm and forearm is called the flexor compartment. So those muscles which are located in the anterior compartment, they will definitely cause the flexions of the arm or forearm. So as the coracobrachialis is located in the front of the arm, so it will front of the arm or flexor compartment of the arm, so it will definitely help in flexions of the arm, as well as it helps in adduction of the arm. So this is the coracobrachialis. Look at that, it is originating from the tip of the coracoid process along with the short head of the biceps brachii. Look at that, short head of the biceps brachii, it also originating from the tip of the coracoid process. Then after originating, it is inserted in the middle 5 centimeter of the medial border of the humerus. Okay, middle 5 centimeter of the medial border of the humerus. And what's this section? Its section is, as it is located on the anterior compartment, so or flexor compartment, so it will flexion of the arm, and as well as it is inserted on the medial side, okay, medial border of the humerus, or you can say the medial side of the body, so it will move the humerus medially. So medial rotation is known as the adduction. So it will help in adduction and flexion of the arm. Our next muscles of the anterior compartment is the brachialis. Okay, so where does it take origin from? It arises from the lower half of the anterior surface of the humerus, or in short we can tell lower, more specifically we can tell lower half of the front of the humerus, including both the anterior medial surface and anterolateral surfaces, as well as some anterior border of the humerus. So lower half of the humerus, both anterior medial surface and anterolateral surface, and including the anterior border of the humerus. Then insertion, it is inserted on the anterior surface of the coronoid process of the ulna, including ulnar tuberosity. That means it is inserted on the ulna. And nerve supply same as the anterior compartment, musculocutaneous nerve, but we have to remember in the upper limb there are two muscles which has dual nerve supply. That means it is supplied by the two nerve. One is the brachialis and another one is the flexor digitorum profundus. Brachialis and flexor digitorum profundus, these two muscles are supplied by two nerve. That means they have dual nerve supply. So it is most frequently asked in the viva, tell me the muscles, name of muscles which have dual nerve supply in the upper limb. So one is brachialis and another one is flexor digitorum profunda, which is a muscle of forearm. So the brachialis has is mainly supplied by the musculocutaneous nerve and partly supplied by the radial nerve. So musculocutaneous and radial. So it has dual nerve supply. Then what is the function? As we told that as it is lies in the anterior compartment or flexor compartment, so it is function is a flexion of the forearm in all positions. So let's see. This is the brachialis. So this is the brachialis. It is originating from the lower half of the humerus, including the anteromedial and anterolateral surface, and including the anterior border also. Then it is inserted on the ulna. It is inserted on the coronoid process of the ulna, anterior surface of the coronoid process of the ulna. And its function is, as it is an anterior compartment or flexor compartment, so its function is a flexion. And look at that, it is originating on the humerus and inserting on the ulna, so it will cover the, it is passing over the elbow joint, so it will act on the elbow joint, so it will causes flexion of the elbow joint. Then we have to know some characteristics, or at the insertion of coracobrachialis some important anatomical events occur. We should know what are the important anatomical events or anatomical changes occur at the level of insertion of coracobrachialis. We know coracobrachialis is inserted at the middle 5 cm of the medial border of the humerus. So here are some important changes or events occur. So let's see what are they. The circular shaft of the humerus becomes triangular at this level. Number 2, brachial artery, which lies usually medially, it passes from medial side to the anterior aspect. That means it moves from medial side to anterior side. Then the basilic vein pierces the deep fascia. Median nerve crosses in front of the brachial artery from lateral to medial side. The radial nerve pierces the lateral intermuscular septum and passes from the posterior compartment to the anterior compartment, and ulnar nerve pierces the medial intermuscular septum and go to the posterior compartment, and the medial cutaneous nerve of the arm and forearm pierces the deep fascia, and nutrient artery pierces the humerus. So let's see. It is not a true anatomical picture, it is a diagonal picture. So let's see. The brachial artery passes from medial to the anterior aspect. The brachial artery, it easily lies to the medially, then it goes to the anterior aspect at the level of the insertion of coracobrachialis. The basilic vein pierces the deep fascia, and median nerve crosses in front of the brachial artery. This is the median nerve. So this is a picture at the level of insertion of coracobrachialis. The brachial artery, this is the brachial artery. The brachial artery moves from medial aspect to the anterior aspect. This is the lateral side and this is the medial side. Okay. Then the basilic vein pierces the deep fascia, and median nerve, this is the median nerve, it moves from lateral side to medial side in front of the brachial artery. So we can see the median nerve, it passes from lateral side to medial side in front of the brachial artery. Okay, then the radial nerve, this is the radial nerve. The radial nerve pierces the lateral intermuscular septum. This is the lateral intermuscular septum. It pierces the lateral intermuscular septum and moves from the posterior compartment to the anterior compartment. And the ulnar nerve, this is the ulnar nerve. The ulnar nerve, it pierces the medial intermuscular septum. This is the medial intermuscular septum. After piercing the median intermuscular septum, it goes to the posterior compartment. Okay, from anterior to posterior compartment. And the nutrient artery also pierces the humerus at this level. So these are the anatomical events at the level of insertion of coracobrachialis. So this is up to the anterior compartment of the arm, and we will now learn about one important nerve, that is the axillary nerve, the courses and distribution, and one important artery, this is the brachial artery, and an important thing, that is the cubital fascia. Okay, so let's learn about the mosquitocutaneous nerve. It is clinically very important. So in the viva it is asked, tell me the course of mosquitocutaneous nerve, or which muscles are supplied by this nerve. Okay, so let's learn. It is a very small nerve. The mosquitocutaneous nerve, it is the nerve of the front of the arm. You can see it is located on the front of the arm, and it arises from the lateral cord of the brachial plexus. So when any name of nerve comes to teacher's mind, he definitely will ask it comes from which cord of the brachial plexus. So mosquitocutaneous nerve, it comes from the lateral cord of brachial plexus in the axilla. Then it runs downward and laterally and pierces the coracobrachialis After passing the coracobrachialis, then it passes between the biceps and brachialis muscles. Then it appears at the lateral margin of the biceps tendon and pierces the deep fascia just above the elbow and descends as a lateral aspect of the forearm as lateral cutaneous nerve of the forearm. So we can see this musculocutaneous nerve after arising from the lateral cord of the brachial plexus. It pierces the coracobrachialis, passes between the biceps brachii muscle and brachialis muscle, and then appears at the lateral margin of the biceps brachii tendon and pierces the deep fascia just above the elbow. Then it continues as a lateral cutaneous nerve of the forearm. So, what are the structures are supplied by this nerve? You can see the muscular branches. That means which muscles are supplied by this nerve? Biceps brachii, coracobrachialis, brachialis, the three muscles of the front of the forearm. It pierces the brachialis, so it will definitely supply the brachialis muscle. It passes between the biceps brachii and coracobrachialis, so while passing through these two muscles, it will also definitely supply this biceps brachii and coracobrachialis muscle. Then cutaneous branches. At the elbow, we studied that it continues as a lateral cutaneous nerve of the forearm. So cutaneous branch is the lateral cutaneous nerve of the forearm, and it will supply the skin of the front and lateral aspect of the forearm. And some articular branches as it passes through the elbow joint, so it will supply the elbow joint. Okay, now let's see the picture. This is a very good picture of musculocutaneous nerve, the course of musculocutaneous nerve. You can see, look at that, it is originating from the lateral cord of the brachial plexus. Then it pierces the coracobrachialis muscle. This is the coracobrachialis muscle. The nerve pierces the coracobrachialis muscle, then it passes in between biceps brachii and brachialis. This is the biceps brachii and this is the brachialis. In between these two muscles, it goes downward and goes lateral aspect of the tendon of the biceps. This is the tendon of the biceps and the nerve lies here. So then it goes lateral to the tendon of the biceps brachii, pierces the deep fascia and continues as a lateral cutaneous nerve of the forearm. Then it is named as a lateral cutaneous nerve of the forearm. So this is the musculocutaneous nerve. So what are the structures they are supplying? Three muscles: biceps brachii, brachialis, coracobrachialis, one joint, elbow joint, and cutaneous supply of the forearm, lateral aspect of the skin of the forearm. Now come to the one important artery, the brachial artery. Okay. Look at that. The brachial artery is the main artery of the arm. It begins at the lower part of the teres major muscle as a continuation of the axillary artery. Okay. We know from the heart the three major vessels arise. That is the BCS. That means brachiocephalic trunk, left common carotid, left subclavian. Then this subclavian artery is continued as a axillary artery. Then axillary artery is continued as brachial artery, and this brachial artery starts at the lower border of the teres major, which is a continuation of the axillary artery, and it terminates in front of the elbow at the level of the neck of the radius, and then divide into radial and ulnar artery. That means the brachial artery at the level of the neck of the radius, they divides into two artery. One is the radial artery and another one is the ulnar artery. Okay, so we have to know the branches. What are the branches that are given by the brachial artery? We already know about one branches. This is the artery profunda brachii. While we studied the humerus in the Posteriorly there was a radial group or spiral group, and the content of spiral group or radial group was two structure. One is the radial nerve, and another one was arteria profunda brachii. So look at that, the branches of the brachial artery. First is the arteria profunda brachii. Look at that, it is passing through the posteriorly, that means through the radial group of the humerus. Okay, so this is the arteria profunda brachii, this artery. Then it gives some, this is the ulnar side and this is the radial side. So in the ulnar side it gives branches like superior ulnar collateral artery, inferior ulnar collateral artery, and nutrient artery is a branch of the brachial artery, some muscular branches, radial collateral artery, and medial collateral artery. Okay, so these are the branches of the brachial artery. There's some muscular branches, arteria profunda brachii. Look at that, where it is located. It is located in a spiral group on the posterior surface of the humerus. Some nutrient artery, superior ulnar collateral artery, inferior ulnar collateral artery, and there are terminal branches of the radial artery and ulnar artery. Now, why should we know the anatomy of the brachial artery? Because it is clinically very much important. While we measure the blood pressure, we actually measure the pressure at the brachial artery level. Okay, so before measuring blood pressure, we should know where it is located. It is actually located in the cubital fossa. Okay, the brachial pulse is commonly felt in the cubital fossa, just medial to the tendon of the biceps brachii, and its pulsation is ausculted for the recording the blood pressure. That means for measuring the BP, the pulsation of brachial artery is ausculted. Okay. While we measure the blood pressure, you will notice there is a cuff. It is tied around the arm. Okay, and we put a stethoscope over the pulsation of the brachial artery. That means pulsation of the brachial artery is needed for the measurement of blood pressure, and its exact location is just medial to the tendon of the biceps brachii. So while we palpate the brachial artery, at first we have to find the tendon of biceps brachii. Tendon of biceps brachii. After finding it, we will go just medial to it and we will find the brachial artery. Then our next topics is the cubital fossa. Okay, the most important topic of the front of the arm. It comes frequently both in written and viva. Okay, so we have to read the boundaries and content of this fossa. Okay, let's see. The cubital fossa. The cubital fossa is a triangular hollow in front of the elbow. So that means it is a structure, it is a hollow which is located in front of the elbow joint, and it corresponds or homologous to the popliteal fossa of the lower limb. That means it is a hollow or a space in front of the elbow joint, and it is homologous to the popliteal fossa of the lower limb. So let's see the boundary. Laterally, it is bounded by the medial border of the brachioradialis muscle. Medially, there will be lateral border of the pointer teres, and the base is formed by an imaginary horizontal line where the two epicondyles of the humerus join. Okay, medial and lateral epicondyle of the humerus. If we join an imaginary line through connecting these two epicondyle, this is the base. Then apex is the meeting point of the lateral and medial boundaries, and the floor is formed by the two muscles. One is brachialis and another one is a supinator. And the roof is bound by the skin, superficial fascia and deep fascia. So let's see, this is the cubital fascia. Okay, this is the cubital fascia. So let's see what are the structures, what are the boundaries. At first, come to the medially there is the part of the pronator teres. Okay, so medially there will be pronator teres muscle, and laterally there is brachioradialis muscle. So this is the brachioradialis muscle, and the apex is the meeting point of these two muscles. And the base is formed by an imaginary line that connects the medial and lateral epicondyle of the humerus. So medially pronator teres, laterally brachioradialis, apex is the meeting point of these two muscles, and base is formed by the meeting point of an imaginary line which connects the medial and lateral epicondyle of the humerus. Okay, and base is formed by the two muscles, and roof is formed by the skin, superficial fascia and deep fascia. Now let's see what are the contents in the cubital fascia. So we have to remember this content from medial to lateral side. Okay, so what are the structures in the medial to the lateral side in the cubital fascia? Number one is the median nerve, this yellow structure, then brachial artery, then tendon of the biceps brachii. This is the biceps brachii muscle. So this is the tendon of the biceps brachii, and last one is the radial nerve. This is the radial nerve. So we can remember easily by mnemonics. Okay, what is this mnemonic to remember the content? This is the my bottom turn red. Okay, so from medial to lateral the structures are the for median nerve, bottom for brachial artery, turn for the tendon of biceps brachii muscle, and red for the radial nerve. So my bottom turn red. So from medial to lateral, median nerve, brachial artery, tendon of the biceps brachii muscle and radial nerve. So these are the content of cubital fascia. So let's see. So from medial to lateral, median nerve, biceps brachial artery, biceps, tendon of the biceps brachii and radial nerve. Okay, there is another some clinical importance of the cubital fascia. The median cubital vein lies in this region, and it is frequently chosen for collecting any blood samples. Okay, and we already told, for measuring blood pressure we need to feel the brachial artery pulsation to take the blood pressure. Now let's see which one is the median cubital vein, and from this vein we collect the blood samples for any blood test like CBC, ESR, whatever you can say. So let's see medial cubital vein. This is the median cubital vein. Okay, this is the median cubital vein. It is located in the region of in the roof of the cubital fascia actually. we already told that in the roof of the cubital fossa there are three structures. These are the skin, superficial fascia, and deep fascia. Skin, superficial fascia, and deep fascia. In the superficial fascia there is median cubital vein, which connects the cephalic and basilic vein, and medial and lateral cutaneous nerve of the forearm. So it is actually content of the roof of the cubital fascia. So this is median cubital vein. It connects the basilic vein and cephalic vein. This is the basilic vein, and this is the cephalic vein. So it connects basilic and cephalic vein, and we collect any any blood sample from this median cubital vein. Okay. So two clinically important structure. Number one is median cubital vein, and number two is brachial pulse. So this is up to the front of the arm. Now come to the posterior compartment of the arm. In the posterior compartment of the arm, there are only one muscle. There is only one muscle. This is the triceps brachii muscle. Triceps brachii muscles, and their own nerve supply is the radial nerve. As the radial nerve passes in the posterior aspect of the humerus, so definitely it will supply the posterior part of the arm or posterior compartment of the arm. Then the artery is the artery profunda brachii, and we already know in the radial group in the posterior aspect of the humerus, the radial nerve and artery profunda brachii passes. So the artery profunda brachii definitely will supply the posterior compartment of the arm. Then some other structures that also passes through this component. This is the ulnar nerve and ulnar collateral arteries. Now let's learn about the triceps brachii muscle. Okay. So the triceps brachii muscle, it is originated from the triceps brachii. Seps means head and cry means three. That means this muscle has three head. Okay, so it is originating via three head: long head, lateral head, and medial head. The long head arising from the infraglenoid tubercle of the scapula, and lateral head arising from the above the spiral groove of the posterior aspect of the humerus, and medial head arising from the below the spiral groove on the posterior aspect of the humerus, and it is inserted on the posterior part of the superior surface of olecranon process of ulna, and nerve supply is a radial nerve. The actions, I want to say one thing, that is the muscles which lies in the anterior compartment. The another name is anterior or flexor compartment. So the muscles which lies in the anterior compartment, they will cause flexions, and the muscles which lies in the posterior compartment, or another name is extensor compartment. So the muscle which lies in the posterior compartment, they will cause extension. So look at that, as triceps located on the posterior compartment of the arm, so it will cause extension of the elbow joint. Why elbow joint? Why not the humerus joint? As it passes over the elbow joint. Okay, there the triceps passes over the elbow joint and it is inserted over the ulna, so it will definitely act on the elbow joint. So it is a powerful extensor of the elbow joint. So let's see. The triceps brachii originating from the long head is coming from the infraglenoid tubercle of the scapula, and medial head and lateral head. The lateral head originating from an oblique ridge on the posterior aspect of the humerus. Okay, this is the radial groove. Here the artery profunda brachii and radial nerve passes. So above this radial groove, from an oblique ridge or above the radial group. In short, we can say this lateral head of the triceps originate, and below the radial group, rest of the part of the posterior surface of the humerus, the medial head arises, and from the infragluteal tubercle, the long head arises. Okay. So after originating, they ultimately inserted in the ulna, posterior part of the superior surface of the olecranon process of ulna. So this is up to the posterior aspect of the arm and triceps muscles. Thank you everyone.